Have you ever had a feeling of hopelessness? Have you or do you no longer find interest in things that once brought you joy? If so, you may be suffering from depression. Today I'm going to inform you on what depression is, different types of depression, and how you can treat depression. Depression, according to Webster's Dictionary, 2004 copy, 11th edition, is a psychoneurotic or psychotic disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, and significant increase or decrease in appetite, and sometimes spent sleeping, feeling of rejection, hopelessness, and sometimes suicidal tendencies. Different types of depression. There are a few different types of depression: major depression, psychotic depression, prenatal and postnatal depression. Major depression is listed, has symptoms as loss of interest in normal activities, sleep disturbances including insomnia or sleeping too much, tiredness or lack of energy, anxiety, frequent or reoccurring thoughts of death, suicidal thoughts and attempts. With most people suffering from major depression, symptoms get so hard that they affect your day-to-day life and becomes very noticeable to you and the people around you. Psychotic depression. Information collected from www.health/depression/major-depression-with-features-complication 6 states that psychotic depression is when you experience psychotic symptoms plus the sadness and hopelessness of depression. Psychotic symptoms include delusions, hallucinations, and paranoia. Psychotic depression also goes by depressive psychosis, and most people that experience this form of depression are afraid to tell their peers. Prenatal and postnatal depression. Prenatal depression is typically the type of depression that occurs during pregnancy in women. The main symptom is mood swings that last longer than 2 weeks. Postpartum depression or postnatal depression is depression normally after childbirth and becomes noticeable as soon as a week after childbirth. Many women experience this type of depression. Major symptoms of postpartum depression are feeling overwhelmed, excessive crying, intense irritability and anger, and feelings of worthlessness and shame. There are many different treatments for depression as listed on webmd.com/depression/symptoms-depressed-anxiety-12/treating-depression 3, page 1. Types of depression treatments include medications. For example, some of the medications used to treat depression are Prozac, Zoloft, and Lexapro. Another way to treat depression is psychotherapy, which is therapy for short. When a person goes to seek out psychotherapy treatment, they normally talk to a licensed and trained mental health care professional. A third type of treatment for depression is electroconvulsive therapy, a treatment which uses small electric currents which are passed through the brain and is said to reverse symptoms of depression. Depression can be very scary for the people suffering from it and their loved ones. I hope the information that has been shared with you today will help you get a better understanding of depression, the types of depressions, and how it is treated.